Sometimes I start using it less often, like one time every day. But at the end of the day, I like how Kevin Mann said, we will brush our teeth twice a day at least. So incorporating that into our routine shouldn't be a big problem. But yeah, sometimes I do have struggles with it, especially when I go to sleep at some chick's house, or maybe I go to sleep in a hotel or with some friends. It's annoying sometimes having to apply it.
Definitely.
Yeah.
Have you guys ever been tempted to use oral minoxidil?
Kinda. I guess I've had the temptation before, but I just the fear monger of like all the crazy side effects it can have, and like the all body hair growth is something I just did not want. So eventually, yeah, it just slipped my mind.
For me, it's that like they never really proved if it was dose dependent. The very serious side effects. The what was it? The cardiac.
Pericardial effusion.
Yeah, pericardial effusion. Yeah. So yeah, that's what's really put me off of it.
Oh yeah, that's true. For me, I have two concerns. One are health related concerns because we don't have a good prospective study regarding efficacy and
Exactly.
safety for AGA for people without blood pressure problems and stuff. So that's one thing. And the other thing is hypertrichosis. I just don't want that. But the thing is that a lot of people, they say, oh, we have studies on oral minoxidil, blah blah blah. But those are not prospective studies, and the difference in reliability re- um, between prospective studies and retrospective analysis is huge. So I don't trust retrospective studies that much, and I wouldn't risk my life for my hair because why would I need hair in my grave? Like, you know what I mean? But I know that there's not a high chance, but even the two case reports on extremely low doses of oral minoxidil, and they were case reports of pericardial effusion, which is not something you develop for a nocebo effect, definitely. So those
Yeah.
two case reports, they show us that the side effects, maybe the incidence of side effects gets lower, the probability of developing pericardial effusion gets lower when you use a lower dose, but it doesn't go away. There's still that risk. And yeah, I think the data is not there to just recommend or even use it.
Exactly. Yeah. And it seems to be something that's, again, dose independent. So it's intrinsically tied to the subject's genetics, right? How they respond to it. So exactly, like it hasn't fully been demonstrated, at least to me, it being safe. And whenever I watch a dermatologist talk about it online, it's always presented like, oh yeah, that's a possibility, but it's safe. But it's like it's a possibility of something serious, right? Like if you look at JAK inhibitors for alopecia areata, you it is possible when you suppress the immune system, you could get some sort of cancer to it, but that hasn't been demonstrated. But they do have some people within their clinical trials that they've noted having, blood clots, right? A marked elevation in their cholesterol, right? So there's always risks to these things, but I think we just need better oral minoxidil studies. But it seems to be, yes, it is dose independent, and you can develop cardiac issues at a low dose.
Oh yeah, that's concerning. I don't know why it's taken so lightly. A lot of doctors, the dermatologists say this, oh yeah, take this pill and yeah, no problem. I'm not gonna do cardiac monitoring. I'm not doing anything. Just take this pill and yeah, go on with your life. And that's, in my opinion, that shouldn't be the case. Like this thing needs to be investigated further. Like I remember reading a scientific study on the incidence, on the probability of developing pericardial effusion on the standard dose for blood pressure, right? And it was high. Like the probability of developing pericardial effusion, which can be deadly, by the way, was like a 6%. And that's not low life for life-threatening side effects. So yeah.
Definitely, yeah.
And I know it's like pretty toxic to cats. Like if cats orally ingest it, they're like it's fatal to them.
Oh yeah.
So all mammals are similar to some way. So no, it's scary. You never know the
I
long-term
had
effects of oral.
exactly, yeah, like the long-term effects. Exactly, yeah, that's what's concerning. You don't know if it's destroying your blood vessels too. Who knows what it's doing long term? I had this one. I have this one friend. We're still friends. I don't know why I said had. But they went to the dermatologist and they were like, "Yo, can I just get finasteride?" The dermatologist was like, "Oh no, that's dangerous. Use oral minoxidil instead." And it's like, "Oh, okay."
Yeah,
Wow.
that's
Wow. This is damn. They should look at the data. So you're risking. So you're comparing 2.2/3% possibility of developing reversible erectile dysfunction, and you're saying that's dangerous, but the risk of developing like a drug that can give you pericardial effusion is not dangerous compared to it. Like, I don't get it. Like, I think there's like a lot of people, doctors and stuff, they don't look at papers. As soon as they graduate, as soon as they finish studying, that's it. And I
That's
think
the
that's
sad part of it. Yeah, that's very sad because
yeah.
I've heard people coming to their dermatologist with more information about drugs than the dermatologist even knows about, and that creates a lot of like distrust of the of medical institutions to the point where people think they have complete agency to start self-medicating, right? It's just I don't know, it's just it doesn't give that much confidence when
Oh,
it comes to these particular treatments. Yeah.
yeah, 100%. Couldn't agree more. And that's the one thing that I notice is that a lot of these terms, it's either that they don't study after they graduate, like they don't look at studies, or they're just dishonest. Because I've been approached, like I've gone to dermatologists that told me to do the weirdest stuff. Like I mentioned at the beginning, that kind of scam that they proposed me. But I had also another dermatologist told me that finasteride can make my penis smaller, and as soon as I stop it, I'm gonna lose basically almost all my hair all of a sudden. And this is just one instance because I have many, but I don't wanna take too long to describe all the things. But yeah, and when you bring up the data, and when they find out that you know about studies and stuff, they can get defensive.
Oh yeah, definitely.
yeah.
I've experienced that. They get some of them get very defensive. It's kind of strange. We had that one guy in the server. I'm not going to say his name, but he's in the server. He talked about how he went to go, essentially confront his dermatologist to give him a biopsy because his dermatologist was like, "It looks like you have alopecia areata." When in reality, he just has male pattern baldness, a conventional male pattern baldness. And then he put him on all these topical steroids, and it caused, other issues because he had him be on it for an extended period of time. And then just him trying to get his biopsy data from this dermatologist is kind of like, it's really strange how resistant this guy is to just, giving him his results. And the way I look at it, it's like this, like, okay, finasteride, you lose your dick. Okay, go get a Viagra, right? In the extreme ultimate worst case ever, your dick falls off and rolls into the garbage bin, right? Um, with oral minoxidil, your heart is gone. You're dead completely, right?
Yeah.
So the fear mongering, for one, I think is a bit more justified than the other, and that surely being oral minoxidil. We again dose independent pericardial effusion.
Mhm.
I don't know. Maybe one day if I say, who cares? Fuck it, right? But I can't